Hi everyone, it's Elle. Now we're going to talk about the HADS, the Hospital Anxiety and Depression Scale. If you are a healthcare provider, I would be surprised if you have never heard of or used the HADS before. It's extremely common because it's simple. It looks for symptoms of anxiety and depression as those both go together. It was created to be used in the hospital, which is ideal for hospital workers who are assessing postpartum women. So the way that it works, you can have a Google form, that's what I use, or you could do a paper form, in which case I typed this up and made it available to you. And if you use the paper form, then moms would simply read the parts that are bold. So I feel tense or wound up. And then they would, explain their level of agreement or disagreement with that. So let's say I feel tense or wound up most of the time, a lot of the time, from time to time, occasionally, to not at all. And then I would circle, okay, a lot of the time. Life is stressful, right? Okay, so two. And then I would go through each one. As you can see, the two columns, there's a D and an A, and that stands for depression, and that one stands for anxiety. Also, if you look, it is reverse scored. So for anxiety, it goes 3 down to 0, and for depression, it goes 0 up to 3. And it's easy to tell which one's depression, which is anxiety, because one is in the dark and then one is in the light over to the side. So you just simply circle which one you agree with, go through each one, and then when you go to scoring, you add up the D column and then you add up the A column and you put it here. Okay, and you just need to make sure that each one was answered. And once you have that, and let's say that you get a 10 for depression and an 11 for anxiety. So that would indicate that your depression score was borderline abnormal, and then your anxiety score was abnormal. And this is something that you would then want to take to your physician and to your primary care provider, psychiatrist, and clinical psychologist, whoever is available, because this document is very good at finding symptoms of these disorders. However, it is not capable of diagnosing you. In order to do that, you need to have a qualified healthcare provider do that. And it's pretty simple, pretty straightforward. This has been around for quite a while, since about the 80s, and it has been shown to be valid and reliable. For each assessment that I used ones that were proven to be valid and reliable and had been around for a while and used in several studies. I did that partially to match the various academic articles I used to inform my project, but I also did that because, me creating assessments is going to be far less accurate compared to assessments that have been tested and borne out to be correct, accurate, valid, reliable. So what is validity and reliability? So validity is, are you measuring what you mean to measure? And so there's a way that you can look to see if the questions are in agreement and they're measuring anxiety, right? That construct as opposed to depression. And then for reliability, do you have similar results every time people take the test? Meaning that if they really do have depression, do they get high enough scores that show borderline or abnormal that then is diagnosed by a qualified healthcare provider? So it's very important to make sure it's valid and reliable, because you don't want to send moms to their physician based off of the word of their occupational therapist. It's more important that they have a valid and reliable instrument that they can bring in, and they can give that to the physician, either giving them the score or actually giving them the paper with the results. It's important so they can address it and they can have the best information possible to diagnose you. So I hope that was helpful. The HADS is a great instrument. There is information with the origin, so the creator. There's authors that talk about this, Zygmunt and Snaith. Okay, it's something you can access. I provided that reference, and then also it gives you the guidelines for scoring. Okay, good luck.